Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Shwas Vyadhi, and to differentiate between Shwas Vyadhi and Shwas Lakshan, I have put forward you an interesting case which I saw in my practice. Always remember, many a times Shwas Lakshan is taken as Shwas Vyadhi and treatment goes on the wrong path. Hence, always decide first whether you are treating Shwas Vyadhi or Shwas Lakshan. If Shwas is the Lakshan, then you have to treat the main disease because of which this Shwas Lakshan has been created in the body, and along with the treatment of that main disease, you can give the treatment of Shwasa as symptomatic treatment. Another factor which I forgot to tell you is the psychological factor. Especially in the known case of asthmatic patients or stomach Shwas patients, any sad news or some incidences triggers this Shwas suddenly. So always remember, where you are going to take the history, take the past history, present history, and also evaluate the psychological factor of that patient. Hope you understand all these things. In one of the last episode, I put forward you one problem that if stomach Shwas is a Kulaja Vyadhi and it gets transmitted to the next generation. If some person comes to you and asks you that we have family history of stomach Shwas, what can you do to prevent this Vyadhi to go into the next generation? Is there any solution or not? And I am very proud to tell you that the Ayurved is the only science which has got some solution for this problem. I am not claiming at all that Kulajak Vyadhi will be stopped to go into the next generation. Never. But with the help of Ayurved, we can try to at least reduce the intensity of this Kulaja Vyadhi in the next generation. Let us see how we can manage this problem. When there is in Ayurved, before conception, in the Grantha they have specifically mentioned that husband and wife should go for the Panchakarma when they are going to have a family or have a child, because by Panchakarma both of them will get Deha Shuddhi and also Bija Shuddhi. So the first reference in Ayurveda to prevent such Vyadhi to go into the next, what we can do to ask the both husband and wife to have Panchakarma before they are leaving the planning or they are planning to have a child. So this is the first reference given by Ayurveda. What is the second way we can try is, of course, the Rasayan Chikitsa. Always remember, Rasayan Chikitsa, okay, in Jarayadi Vidwansan or it is in the definition it is told that Uttan Dhatu is created. It is right, but Rasayan Chikitsa is useful to form Uttam Prashasa Dhatu, as well as it will give strength to a particular strotas or particular organ also. So Rasayan Chikitsa is useful for dhatu, for strotas or a particular organ also. So the second way which we can deal with this problem, to give Rasayan Chikitsa to both husband and wives. See, if family history is only on husband or in the wife side, still for the good conception and for the good baby, we can start the Rasayan Chikitsa to both of them. Now which rasayan is to be given, again it's your point of view, because patient is in front of you and not in front of me. So whether to choose Pipali or Kantakari or Chawamprash or Amalki is totally your decision. The decision also depends on the Desha Kala Prakriti as well as financial status of the patient also. If patient is affordable, you can add Suvarnakalpa. For example, Sudamali Vasanta, etc. And if patient is not affordable, then you have to go for the choice of the drugs which have on the cheaper side. So for this purpose, to reduce the intensity in the next generation, start Rasayan Chikitsa to both husband and wife well before they are trying to the baby. The third question appears that if you started Rasayan Chikitsa, a wife and husband came to you and said we are going to have family, and you started Rasayan Chikitsa. Again, which kalpana is to be used is your choice, which drug is to be used is your choice after checking or examining the both husband and wife. The question is how long the Rasayan Chikitsa is to be given, and the answer is till the birth of the child, at least for the female. For before conception, you should give Rasayan Chikitsa to husband and male both. When pregnancy is confirmed, you can give or you can continue Rasayan Chikitsa to the female partner only. Again, when you are giving Rasayan Chikitsa in pregnancy, you have to see the indications and indications of that particular drug or kalpana in the pregnancy. So, first have Bija Shuddhi or Deha Shuddhi before conception of both husband and wife by Panchakarma. Second, start Rasayan Chikitsa for both husband and wife when they are trying for the baby. Give Rasayan Chikitsa to the female even after conception till the birth of the child. Other aspects of this Kulaja Valley and Ayurved we will discuss in the next episode. Thank you very much.